All right, we want to welcome everybody to today's Communiqué. Thank you so much for joining us. As we know, December is HIV and AIDS Awareness Month, and we are so excited to have Dr. Susan Ward Jones, who is the medical director of the East Arkansas Family Health Center, which is a part of the Community Health Centers of Arkansas. Here today, just to talk a little bit about what HIV, what HIV is, what AIDS is, and just some of the things that they have going on in Eastern Arkansas. So thank you for joining us today, Dr. Ward Jones.
Thank you so much. Good morning. Good morning.
And so before we jump into the conversation, let's just introduce you to everybody. Tell us a little bit about you and how you got to East Arkansas.
Well, thank you so much for having me, Kenya. As stated, I'm Dr. Susan Ward Jones. I'm the CEO, actually, of East Arkansas Family Health Center. Previously, the medical director and been CEO for some 14 years.
Okay.
I actually am a product of Helena, Arkansas. Grew up in Helena. Mom and brother and relatives are still there.
Oh,
Left there and went to school at a HBCU, Dillard University, in New Orleans, Louisiana, and came back for medical school and internal medicine residency at University of Arkansas for medical sciences, and actually came over to Eastern Arkansas. And to be honest, really to come to this health center just to pay off my loans, and never thought I would be here some 24 years later. So I know I don't look like it, but I'm here and have really been fortunate to be where I am.
that's wonderful. There's no place like home, right?
Yes, yes, definitely.
So, like we mentioned, December is HIV and AIDS Awareness Month, and we want to focus our conversation on those two particular topics. And so, just to begin, let's talk about what HIV is and then what AIDS is and the differences between the two.
Well, simply HIV is just the virus that attacks the body's immune system, human immunodeficiency virus. And if left untreated, then it leads to AIDS, acquired immunodeficiency syndrome. Most people early on, there were a lot of AIDS cases, but with new medication and effective medication, most people don't get AIDS now. Most people can live, just with the HIV status.
All righty. And so we know that with a lot of other chronic diseases and illnesses in the state of Arkansas, HIV is part of the diseases or conditions that's affecting a lot of people here in the state. And so, what would you say is the prevalence of HIV and AIDS, both in the state of Arkansas and particularly in communities of color?
Well, there are 6,000 people living with HIV/AIDS in Arkansas, which, of course, the population in Arkansas is just a little bit over 3 million.
Okay.
And the stats really go back to 2017, but it reported that 8.4 out of every 100,000 Arkansans were newly diagnosed with HIV, and that's the latest
Okay.
report that we have back in 2017. Most of
Okay.
it is concentrated, particularly for African Americans, in the Southeast region, then Southwest, then Central, and then Northeast. Of course, of this, the numbers, 44.5% are Black, non-Hispanic, while we just represent, 15.7% of the total population in Arkansas. So you can see that we're disproportionately affected.
Yeah.
45.6 are white and Hispanic are 5.9%. Now, some of the other statistics show that the age, who's being affected is mostly those that are 25 to 34 years of age at 34%, and 35 to 44 years of age at 27.6%. Here we see most of the demographics in terms of exposure, who contracts the disease, men who have sex with men, 55%, of the population of those that are affected here. And then those that are increased for risk, heterosexuals at 19.7%. And then some, not reported any kind of identified risk at just 1%. And then injection drug use at 8%. So that's
Okay.
kind of the demographics of what we see, where we are. We've had our HIV program actually since 1998, and out of a need, we got Brian White funding. We actually have Part A, C, and Part D as well. So we've been in this fight for just a little while, and have seen just the progression of people, living longer, living with chronic disease. And I like to think of this as a chronic disease. I actually have a couple of patients that have been infected for some 20 years.
Okay.
So it's a chronic disease. People can live. It's not a death sentence as people once. And I will say in the beginning, it was. There were complicated, regimens that had much side effects. There was much stigma. People didn't, want anybody to know. So we've come a long way.
Absolutely. And then for, you mentioned the Ryan White funds. And so just for people who don't know about the Ryan White program, just talk a little bit about what that is and how that helps what you're doing.
Well, the Ron White Fund provides, out of HRSA, provides just crucial funding for the population, provides assistance for medical care, medication, outreach, assistance with living, housing, food, and all those things that take to make sure that people can live, healthy.
Healthy and full lives, yeah. And then you mentioned a few moments ago about the stigma that is associated with having HIV and AIDS. Why do you think that there is such a stigma around HIV/AIDS? And then also, what can we do as communities of color to help combat some of the stigmas that are associated with HIV/AIDS?
I think, most of the stigma, and I think this is true in various, aspects, is just lack of education, and just thinking that only a select group can get this. I
Mm-hmm.
mean, anybody that is at risk can get this. So it's just not the males having sex with males, or those using drugs, or anything of that nature. If you are in, risky behavior,
Right.
you can. So I think a lot of it stems from lack of education, and not really understanding. And I've lived a life where there was so much stigma when we first started, even with mothers not wanting to, touch their children, or thinking they could get it after, drinking behind someone, which all of that is not true at all. I
Mhm.
think that part has gotten a little better, but still there's some stigma thinking that, only, a select group of people contract this disease. So we've come a long way, but we've got still a long way to go. And in terms of, what we can do as communities of color,
Mhm.
and it goes back just to education and outreach, and constant, education to, the disease process, and who can contract this, and what options are available for treatment.
Okay.
I think there's much inroads that still need to be made with that. And here we provide a lot of outreach, education opportunities for, testing. We still have inroads, lots of inroads to make in getting into the churches. I mean, there are some churches that will allow us to come in, to maybe do some education and not testing. There's one
Mhm.
church that will allow us to do testing, in conjunction with, church activities or a church health fair, but really don't want it to be talked about.
Right.
And of course, still, and I hate to say it, but still it's, talked about from the pulpit in
Yeah.
not such a good light. But I think we've made inroads with that, and just, have some, more inroads to make.
Absolutely. Baby steps.
Yeah.
We've come a long way, but we still have some way to go for sure. And so you mentioned some of the myths that are surrounding HIV/AIDS. You talked about how back in the day, not drinking from someone else's cup, and moms not wanting to touch babies and things like that. So some of the other myths that are out there are HIV is a death sentence. And I know that you mentioned earlier that with medication and good health, that it is not a death sentence. And so You were going to say something?
Yeah, no, it certainly is not. And to be honest, we worry more about the comorbidities of the hypertension, the diabetes, the CHF, the other things that you would develop, if you didn't have HIV. So we talk about that with our patients and I tell them all the time, I'm not really concerned as long as we keep your viral load undetected. I'm not really worried about the HIV. I'm
Mhm.
worried about this uncontrolled diabetes that's going to lead to, heart disease and kidney disease, and you ending up on dialysis and amputation. So,
Yeah.
it is a chronic disease, and if effective medication is certainly available, and you adhere to the treatment, then people are just living longer lives for sure.
Absolutely, absolutely. And so you mentioned medications. What are the treatment options that are out there? I've seen a couple of commercials in the past few months about different medications that are out there to help people with HIV live healthy, and then for those who may come into contact with or may be exposed to somebody with HIV as the PrEP
Yes,
medication,
yes,
and then
yes.
a couple of others that I've seen on television. And
Well, as I stated before, when we first started with this treatment back in the late 90s, of course, there were, regimens that you had to take 3 medications or 4 medications, and with horrible side effects and interactions with, other medications taken, and you really had to, treat the side effects with other medications. So it became just really complex. But now we have regimens that are 1 tablet a day with less side effects, and it really has been a game changer in the treatment of HIV. Now, in
yeah,
terms of PrEP, pre-exposure prophylaxis, that and there's a couple of drugs that you can take for that, but it must be given within 72 hours of possible exposure, and really more and more people are reaching out asking, and we certainly try to make it a part of our intake when we, work up patients. And PrEP is just, given to someone who's HIV negative,
mhm,
adults and adolescents who are at high risk for contracting disease, whether it be through sex or injection drug use. So very, very effective. And we're really trying to push that and really get, the appropriate folks on and make it, the option available, seamless, like we have it here on our formulary in our pharmacy. So it's not any barrier to getting the medication.
okay. All right. That's good news for a lot of people. Removing those barriers so
Mhm.
that they can get the medications that they need to again live a full, long, healthy life. And so
Yes.
we thank God for removing those barriers. So
Right.
um, so talk a little bit about we talked about the medications for HIV/AIDS. The testing options that are available for HIV. What are some of the advances in testing that have been about
Yeah,
this?
testing is so readily available. I mean, of course, through the conventional where we draw the blood, or you can do testing from, saliva. I mean, just it's too easy to get it now, and we try to make it, available. But there's still some stigma around testing. We were at a testing event on Tuesday, and it was a group of guys, and we were having, an outreach activity for World AIDS Day, and trying to ramp up testing. And, I think there's just some stigma around just even getting tested. And, of course, we preach everyone needs to know their status. And,
Mhm.
and I actually spoke with my program manager on yesterday about, we've got to get innovative and think outside the box to allow for more anonymous testing,
Mhm.
perhaps maybe send some kits to the house and they can send it back. Just trying to brainstorm on how to increase testing, because there are people living that are HIV positive but don't know their status, and and sometimes people don't want to know,
Right.
but you need to know. You definitely need to know. So we actually make that a part of our intake. Anybody, 18, well, actually 15 to 64, we ask that as a part of our intake, do you want to be tested for HIV, just like we check, your cholesterol.
Right.
So we've made some inroads there and just need to continue to, build upon that.
I think you made a good point offering like some discrete testing. In the I think for testing for colorectal cancer, they send you a packet
Right,
in the mail and you put your
right,
sample in and you just mail it back in. And so maybe the same can be done for HIV testing as well, so that it's discreet, it's seamless, and you know your status.
right.
Um, but I think that a lot of celebrities, well, not a lot, there have been a number of celebrities who have tested positive for HIV and have kind of been spokespeople, per se, for advocating and encouraging people to get tested and to know their status. Do you think that that has helped or harmed the initiative in any way?
Well, I really do think that it has helped, and I look to the I think probably the most well known, Magic Johnson,
Right.
and actually he actually came to Memphis in the I think it was early 2000s to promote awareness of HIV. So I think powerful figures, and he's been living many years with this, and obviously he's taking his medication and he's
Right.
doing what he needs to do, which it's a chronic disease now. So I think in the right venue, I think those folks can be used to further promote awareness, and that you can live a full life.
Right. So, what do you think we as a community can do to kind of help support HIV AIDS awareness, not just in the month of December? We do things to celebrate like breast cancer in October, diabetes in November, HIV AIDS in December. What can we do as a community to kind of help keep the awareness and the advocacy going about HIV, knowing your status, so that people are aware and can be tested?
I think that we must have continue to promote educational and informational programs in various venues. Continue to always provide education, and particularly if we can, we've made some inroads with the schools, because you really need to start there. So there's some schools that will allow us to come and talk to the students about HIV/AIDS. Also, doing, giving condoms and teaching abstinence and PrEP, as we talked about earlier.
Yeah.
Continue with lots of outreach testing, and really thinking outside the box. I mean, we have outreach individuals that, may go to a truck stop,
Mhm.
may go to different, non-traditional places
Right.
to offer testing. So we started to do much of that, and of course, as always, collaborating with other agencies. Two together can do much more than one alone. So I think constant collaboration with other agencies, and then also, which is a powerful tool to use, those that are affected with HIV/AIDS as those kind of peer support, to have meetings with those that are infected, and have someone to say, hey, you can do this, and you can live with this, and and talk about the various things that they've gone through. So I think there's power in even peer support.
Absolutely. Absolutely. So, what advice, just one final question, what advice would you give someone who maybe family members who are trying to support their loved ones who maybe, who have contracted HIV or AIDS? How would you advise family members to support their loved ones?
And I think, Kenya, it all goes back to being educated, and
Hmm.
even having the family members in support groups to understand, and even talk to others that are dealing with similar situations. But I think education is always the key, and peer support, getting with others. And I think, just, and even, understanding, trying to really, really understand what your family member is going through
Mhm.
and trying to be a support. And, and I love when family members come to the primary, the primary care visit, to really understand and perhaps even go over side effects with them so they can know what to expect. So I think, just the constant education, being with others, to know how to support your loved one.
Right, right. That's so important. Being educated, number one, and then offering support, number two, and then getting the treatment, where necessary,
Mm.
number three.
Right, right.
So, Dr. Jones, thank you so much for taking some time out of your schedule to talk with us about HIV, about AIDS, about awareness, about getting educated, and just knowing what HIV is, knowing what your symptoms are, knowing what your status is. Thank you for sharing with us today. We really appreciate it.
Yeah.
And so that's a wrap.
All right. Thank you so much. And I'm